Yeah.
So now we're going to do a side lying external rotation. Again, this is going to be below 90, but one of the things, you're at 90 degrees here and here. So we said sometimes when you come out in this position, you feel a little click. So what you're going to do, though, is remember what happens is that humeral head is rotating out this way. So if that biceps tendon is still a little irritated there, you're going to keep it just below that click. And then I'm going to show you right after this, we're going to sit up and do a little bit with a handlebar. And this handlebar, like I said, I love this handlebar thing. It's great.
Cool.
So the reason you put a towel underneath the elbow right here is because, and we can do a little bit more, is it sits the head of that humerus a little better in the labrum. So, and also has it better, where they found that with EMG studies, is that you get better activation of these external rotators with a little bit in abduction in that position right there. So I don't have a dumbbell right here in front of you, so you're going to hold on to that ball right there. So all I'm going to do is pure side lying, and so you're going to bring that down to your abdomen, and then come back up, and you go as far as you can without getting that click at all. Okay? No pain, no click. You shouldn't have to work through that. And I'm just going to see if I can feel these external rotators. Remember, external rotators, infraspinatus teres minor here. Of course, there's other ones that act as synergistic muscles for that right there. So let's do about 15 here for a second. Make sure
it's going to be a burner.
Make sure you don't, no pain, and you don't want to truly fatigue out the cuff. You just want to activate it really good. When you get better at these, you can do iso holds at the end. Drop it down. Maybe just even just to get to 10 and just do an iso hold for a second. Iso holds are great, and we'll do something with the isometrics here in just a second. So you hold in the lowering phase. The eccentric lowering phase is one of the most difficult things. So you can do a couple second hold right there and bring it back down. So that's one exercise you're going to be working on right there. Mm-hmm. The next one is, I want you to go ahead and sit right up on the edge of the mat table for me. Work that one. Yep, I got you. So this is the handlebar by Dr. Eric Keene. So this is great here because what it does is it works on isometrics, sub-isometrics. So what we're going to do is we're going to work external rotation with this one right here. So those arms will be by your side 90 degrees, and you're going to start to pull out as hard as you can. And then what you're going to do is you're going to feel these kick in right in through here. So you're going to hold it 5 seconds, hold. Okay. 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 1. So then relax. We're going to do a 5 second hold, 5 second relax. So let's do that 5 times. So you bring it on though, like you're stepping on a gas pedal. Okay. So it's just like anything else. That's why I think powerlifters and bodybuilders so they have such great proprioception and stuff, is because they feel these muscles kicking in. So now we're getting tension and tone in these muscles. We're strengthening these back here, and you can see them kicking in, but you can't move that sucker. Well, you probably could if you want to break it, but anyways.
Snap it.
So snap into a Slim Jim. 5 seconds hold, 5, yep, and then contract, relax. Let's do that 5 times. So it's going to feel, and so what isometrics do is several things. They help, again, they give an analgesic effect, a short-term analgesic effect. Did you do 5? Okay. So now you're going to do internal rotation. So now you're going to bring your hands in like you're trying, yep, yeah, absolutely. And you're going to hold 5 seconds. So there's an analgesic effect, short-term. It helps to preload the tissue to get ready for activation. It also helps. They found that Eric was telling me about Dr. Keith Barr. I read some of his work on engineered ligaments and tendon out on the West Coast that showed that actually it helps with the regenerative process and what they call fibroblastic proliferation. It actually helps to rebuild those a little bit. So now you're contracting and you're getting an isometric contraction. You're getting that muscle to activate. You're getting tension and strength in the muscle without causing irritation up here, right? Okay. So now what you can do, here's another one as well. So now we're going to do, this is one of my favorites here, we're going to do an uppercut. So you're going to hold on to this. So now what you're going to do is you're going to pull out, but you're going to come up into flexion about 90 degrees, Jed. So you're going to come up, so pull out and bring your elbow right there and back down. So you're going to just keep your elbows in a little more in line with your body, okay? Right there, yeah.
It's tough.
Yeah, it is tough. Yeah, so pull out and keep it below the pain threshold. So now what are you working here? You're working again. You're activating serratus anterior for your uppercut. You're doing external rotation. Okay? Yeah, I'm telling you, it's a burner. This is a great exercise. It's a great product.
How many did you want?
So let's do 5 set of 5 seconds. Okay, and then you just do. So if you did 3. So that's just like one particular round, and then you slowly contract those muscles. So now we're strengthening this area without aggravating the tissue. Okay? Good. And you're just going to do it. So a simple thing, 5 repetitions, 5 seconds. Keep yourself good form. Okay, is that good right there? Mm-hmm. So that's one example of an exercise. Let's get ready to do the lock 3s. We'll do the lock 3s, which I think are great for rhomboids, lower trap, and stuff like that. So again, I got to give Squat University good props for bringing this up. I've seen it before. It's kind of like the ITYs and stuff like that, but below 90 degrees. Okay. So it helps set. So let's go ahead and lay prone. Let's lay on your face. You wanna?
This way, buddy?
Yep, right now. So let's go ahead. Do you want a, you okay with a towel? Let's go from.
Towel.
You want a towel?
Where?
There you go. If you want to lay your face in it, I mean, So, okay, so what we're going to do now here first, we're going to do these lock 3. So it's going to work on rhomboids, it's also going to work on lower trap. So the first thing is we're going to go ahead and put your arms by your side in a T position. So the idea behind these right here, and it's going to be a little tricky, is we're going to try to set these shoulder blades a little bit before you get under the bar or any kind of overhead pressing. So now what you're going to do is you're going to try to squeeze your shoulder blades together and lift the back of your hands off the mat table. Good, and then back down. And you're going to bring it down slowly. The way they say that is to bring it down slowly like you're setting your hand on an egg. So let's just go ahead and we're going to do that where you're basically, your arms are internally rotated here. Then we're going to externally rotate them here in a second, and then we're going to come out to the side. So just maybe like 5 or so of those. So this is a great one here. We're going to get lower trap, rhomboids. We're going to pull this down here. And then our next set is what we're going to do is we're going to turn our palms out. So we're going to externally rotate it. So your thumbs are going to come up in this position. So now we're going to go back here. Now go ahead and raise them up. You got it. So here, and we're going to start to pull these again together here. Good. And again, we've got to have strong posterior chain right here before, again, because we do so much forward all the time. So just five of these. And then when you're ready, we're going to go ahead and do, we'll come up, we'll go, if you can't get out to 90 degrees, we'll do close to it, right about here, and we're going to do thumbs up, okay? Now go ahead and bring those arms out to the side. Yeah, raise them, squeeze those together. You got it. Yep.
Thumbs towards the floor right now?
Thumbs towards up, like, yeah, if you can, even towards your head. So go ahead and bring those up. So bring these together. Good. And it should be like a burner, right? You're going to really feel these kick in here. Yep. You got it. Here, it's not big motions. It's stability. It's motor control. Good. Just 5 of those. Good.
Then I'll do one more.
Okay, one more. And then the last one we get ready to do, we'll do like a little serratus work here for a second. So when you're ready, go ahead and lay on your back now for me. This is one of my favorite exercises. I love this exercise here. So,
sorry, buddy.
No, it's okay. One of the things we want to make sure to do is we really want to work this serratus anterior. Now, when a guy from Squat University does this, he does it using a bottoms-up kettlebell. So your weaker arm or the affected arm over here is the one we're going to have an impact on. So before you get underneath the bar, so we're going to use these Silex bands right here. If I can see, for one thing, and I'm going to try to get these open here. And what we're going to do is we're going to create an unstable environment and then work on scapular upward rotation. All right.
So it's got like a handle built in there.
Yeah, it's got a handle built right into it, and I just the band. This is awful.
Dude, that is super thin.
Yeah, I can't. Can you see this thing, Jen? Oh, wait a sec. I got one, I think. Here we are. So yeah, it's got the handle built right in, and I just need one more.
There's one.
Okay. So we might need that. So let's go on your wrist on this opposite side over here. Yep, we'll bring it out here. And this one is going to come out. We'll probably use this one that I ripped right here. There we go. Okay, so your hand's going to go in here. Gotcha? Arms come up here in this position here now, right? Mm-hmm. So here, you're going to put some tension in that now. So extra rotation, hold on to the ball. I usually do this with a bottoms up kettlebell. Here in this position, arms straight here. So now you're going to come into, so if this is the kettlebell, you got the horn right here. So now you're going to work upward rotation, but you're going to bring it down to your chest like you're doing a bench press. Keeping that externally rotated. So, yep, bring it down to your nipple line, right here, right there, and then back up. Good. Keep attention in the band. Mm-hmm. So you're going to get external rotators. You can come in here, hold it right there for me for a second. Hold it, hold it, hold it. You can perturbate that at the same time if you wanted to. Bring it back down again. So let's do maybe like 10 repetitions like that. Say 5 to 8, somewhere in there. So that bottoms up kettlebell would be a whole lot more challenging for grip and shoulder at the same time because you've got to hold the horn of that bell and the bottom of the bell is up into this position here. So a little more challenging than this one would be right here, but still you get the idea. So, and again, you're getting extra rotation. Push back up, upward rotation of the scapula. When you flex, unstable recruitment of the shoulder girdle on this side here. And then you always want to keep it below that area of pain and below 90 degrees. This is a great shoulder warm up, those lock 90s.
There's actually a lot of burning going on, like in the...
You're feeling?
Yeah.
Yeah.
like work.
Yeah, work. Yeah. You start to get those scapular stabilizers a little bit more. Okay. Whew. So there we are, man. Whenever you're ready, that's kind of like a run through with the mobility stuff or whatever we do, and then some of the exercises we might do afterwards for that biceps tendon right there. So you see, we didn't do any bicep strengthening.
No.
You don't need to be stronger, dude. You're already way strong.
Right.
You have an unequal stress to load, stress to rest ratio.
Yep.
So we've got to create a balance. So
cool, dude. I appreciate it so much. This was fantastic, and everything that you said that needs to be addressed. I kind of already suspected that, and I was like, I'll wait on it. You know what I mean? But it's been 6 months of waiting on it.
Yeah. Sometimes it is what it is. I mean, we know that we've got to do it, and it's like I always tell people, we got to do your home exercise program. People always say, how often should I do these exercises now after I hurt my shoulder, or even any kind of not even hurting your shoulder? If you're going to competitively train like you are, it's a lifetime thing.
Yeah, it is.
It's a lifetime thing. So,
and I've been able to get away with half-assing the mobility stuff for a while, but I've hit a point now where trying different things, it's an intensity level now where I can't ignore that stuff.
And we ain't getting any younger, right?
Yeah. So that's another huge aspect that I like to deny. But the fact is,
I'm sure you don't recover like you do in your 20s, right?
No,
right.
Especially when sleep is bad. So.
Right. Oh yeah, huge. Yeah. So how's it feeling right now? I mean, better, worse, the same? No
it feels
difference?
Warm.
Okay.
It feels like there's blood in there.
Okay.
It's a little sticky, a little clicky.
Yeah, okay.
But it's also been into some positions where I've been trying to avoid getting into those positions.
Yeah.
So, it might be a little ugly with me right now, but it's not, it doesn't hurt.
Watch, that's what you're going to do. This is just only the first really getting to address it. This is why sometimes I hate to do this and have you go back an hour and something away, without following up in a few days or something like that, because sometimes it'll set you off a little bit. But now you know what you got to do. Just work on that posterior. So I'll put together, once we get up here done, I'll go up and put together get my computer out, use my my MedBridge stuff, and I'll put together some exercises for you. It's also a good one too. Is I really like that Donnie Thompson stuff. I'll show you a couple of videos on using the band of distraction for that shoulder mobilization and across the body. Yeah. I tried it with a patient of mine who with a frozen shoulder, and we loosened him up really good.
Good.
So, some of those put together, I work out pretty nice. So, let's get it done, man.
Thanks,
Absolutely,
appreciate it.
Absolutely. Anytime. You got all kinds of bands stuff at home, right? You want this one to go with you? Might as well take it with you.
Sure.
Yeah. It's got a little nick in one side. Be careful.
That'll be for my use.
Just a little warm up or something like that. Yeah.
Boy, those lock threes.
Yeah.
That stuff, I can feel...
Those lock threes are really good.
I think that's going to be really, really important.
Yeah, I'll write them down. Check this. This is, I'm telling you what, I have, that's mine I use out in the gym out there. And then anything, Theraguns, things like that. All that soft tissue mobility stuff, you can use that stuff.
I'll tell you, I have a rip-off of the Theragun.
Oh, whatever works. I don't care.
It didn't do shit.
Oh, it didn't? No,
it just wasn't what I needed. There's some things
you got a lot of muscle tissue to get through, though. That's the thing, too, right? You got events. Yeah,
it's true.
So some of them, it depends. Some of them are better than others. This one is one of the hypervolts. These things it's crazy how much they are. This was like $400. Are you kidding me? I mean,
I bought mine for like 65 or 70.
Totally, and I just don't get it now. I did some consulting with these guys. So they gave me one. I don't know if this is on. No, it's got to be charged.
It's probably dead. They sit around and they lose their charge.
But I'm telling you, the thing I do like though is these things here. Like I like these Hypervolt minis. So all it is a ball because you can lay on this sucker. You can get tissue and then you can.
Does it agitate?
Yeah.
No shit.
Yeah, dude. So you can put it on pec, you can roll into it, you can lay on your side, you can put it on lat, stuff like that. And this, like I said, this is another. I like these here too, but they're not worth the money. I just wouldn't pay for that.
I have a thing that vibrates.
Some of them are better.
Someone got it for me for Christmas.
Oh, that's great. Yeah,
I've used it a handful of times. Yeah. But I don't end up doing a lot of that stuff at the house, and I've always kept it at the house.
Yeah, I'm with you. I had this downstairs. I hardly ever touch it.
I know. This is really cool. That's a really great idea.
Those are, I'm telling you what, and you can destroy those things. Like I've had them, of course I drop them, stuff like that, but you can lay on the side, you can lay, and then it gets really focal. You can put it in a sock, and if you would throw it in a longer sock, throw it over your back, and if it's area you can't get to, you can't get back here, you can put it and then lean into a wall and hold that there. Yeah. The vibration actually has been shown to get deeper down in the tissue, and that works nice. You can roll out on it. So I do like you can roll with your foot. So those things there, I like those. These things here, I think they're way overpriced. And the biggest thing is I don't care.
This is not getting recorded, by the way.
No, that's okay. No, that's all right. The one thing with these things here is that for when they're way overpriced, like this, they let you use it, start it by Bluetooth. Who cares? I guess you know what I mean.
How about push a button? Let's do that.
We were having this debate the other day. Someone said, my nephew was just like, "Oh yeah, I got these new lights in there." Says, "Hey Siri, turn the lights on." So I'm standing there, and his lights came on, but I'm right next to a switch in his house.
It looks like you haven't set up any HomeKit accessories.
Oh yeah.
Oh,
you yeah.
Yeah. So we're at his house. He's like, "Yeah, hey Siri, turn the lights on." Lights come on. And I'm like, "Okay."
Yeah.
I didn't spend $50 for one outlet.
Right.
Then I'm like, "Are you kidding me?"
Yeah.
Like, come on. But so the thing is you can get crazy with technology and stuff like that, and it's not worth it. So
that's really cool.
But yeah, that's
Hypersphere,
Hyperice Mini. Yeah, it's a but it's the Hypersphere Mini. This one here. This is, like I said, and we use these at work and stuff like that, but I don't use them as much. This though, I like that thing. Those are nice. So
you know what? If you ever wanted to do this again, an info session like this for the YouTube channel, I have something in this finger that has been injured since it'll be 3 years in January.
Really?
I don't know what it is. I cannot get rid of it.
Huh.
Like, to go like that, there's like a little bit of pain in there. It used to be a lot worse. But like, I cannot even crack this knuckle.
Is it a trigger digit or something? You ever stick? Does it stick down on you?
It doesn't stick, but I think it could be something where it might develop into that. Yeah. But it hasn't. It's been 3 years.
Right. Stay the way it is.
Like, and it doesn't interfere in most of my workouts. Yeah. But like from right about here, out to here, and then over to this finger sometime.
Might be the pulleys. The pulleys in there maybe. Well, yeah, I'd love to do something like that.
So like I will not do hub lifting. Because that's a pulley killer.
Oh yeah.
I won't do crimping, anything like this. That's a pulley killer.
Oh yeah.
So like.
Oh yeah.
You know.
Right. Yeah.
Right?
Totally is.
Crimping is a climbing term.
Oh, okay.
So there's like quarter crimp, half crimp, full crimp.
Oh, yeah.
And I guess this is like extremely dangerous when you put your thumb over top.
Yeah. So, you figure just the force of this because you're bowstringing at that point. So the Newton's the force of it. So I just I just did I'm 3 courses deep into a 6-course manual therapy certification. And we just did the digits. So which was out in Chicago. And there's a couple good studies. I had to send them to you. That took a look at for every pound of grip strength in your hand. So we'll get ready to do yours in a second. It's magnified by about 10 to 12 that times at the carpus. So even just between this and this right here. So if you're pulling 100-pound grip strength, you got 1,000 pounds of force that's being generated right here.
Wow.
So I mean, and that's through force plates and stuff like that. So your tip-to-tip pinch, a friend of mine, Virginia O'Brien, who does nothing but film stuff. She's a great lady. She's an older lady and has been around for so long and has done some great work on the thumb. They found with some of her work that for every pound of tip-to-tip pinch, it can be up to 25 pounds force generated at the basal joint so the thumb. So that's why, when we were talking about years ago about, the adductor work and stuff, I'd like to needle that finger.
Dude, we could do that sometime. I have referenced that talk where you talked about the adductor being the workhorse of the hand.
It just
so many freaking times. Yeah. And the thing is, people, they don't understand that one slight modification to modify the force producer of movement can have such a magnitude in your performance.
One of the biggest things she says is if you do anything is to keep this web space supple with your pinching. So if you can get in and you work on that and you release that adductor or do you get pressure and like that, it'll open that up and contract and relax those things there. Then you can get in because they found that by working this muscle here, this first dorsal interossei and this opponens here, this helps to counterbalance this adductor. So you're working in that position and doing these isometric C's will help unload this basal joint. So she was saying like for every pound of pinch, it can be up to 25 pounds transferred to the base. So that's what I'm saying, right? So if a lateral pinch of like 15 pounds, do the math, man.
Yeah, man.
It's so that's why these elderly ladies who have a really small trapezium and low cartilage on the trapezium, stuff like that, will end up having a higher incidence of thumb osteoarthritis because they have this really tight adductor that pulls because it comes from this third metacarpal and inserts over here at the base of the proximal phalanx.
Okay.
And it wants to pull that thumb across.
Wait, hold on. Where's that muscle? Originates over here?
So yeah, so if you go, when we pull up that in a second, that adductor, there's two heads to it. There's an oblique head and a transverse head. It comes off the third metacarpal. It's deep. So it's broad, and it actually has the proximal oblique portion has actually attachments on the capitate. So it comes here. If I had to draw it, it comes in a fan shape over here. It's deep.
Well, so I wonder if it's actually that muscle that's causing the problem here. Because the problem's right here. I mean, if it's fanning out to
it's a possibility. It really is, Jed. Is there any pain or tenderness in there at all? It's a possibility. But it could be, because it could be anything. It could be a little bit of the... It could be, so the A1 pulley, A1 and A2 pulleys are right here. That's just the A1 is when they cut with trigger fingers. Then you have 5 annular pulleys and 3 cruciates. These cross over annular pulleys, and then there's another one up here, annular pulleys. And so these things here, it could be just there's so much force being generated there. There's some people that do like active release. They pin and stretch this tissue, open that up. But this palmar stretch, one of these things here, opening this thumb back up in retro position, stuff like that, will help. I mean, with that adductor, it comes from here, fans across, so it's a triangle shape, right, and inserts right there.
If you want to do another one of these, I will drive up here.
Well, we can do that. Yeah, let's do it. Let's plan on doing it. And we could do like we could even do for your guys, for your people too, a little bit of anatomy review and stuff. We could talk about those and how those. Just have a conversation about that stuff. And then if you want, we could do some dry needling in there. We could do some soft tissue work, open it up, some pin and stretch, those types of things, and really help out with it. Because if you can keep those hands, just a few of those things like mobilizing the web space, work the opponents into first dorsal interosseae, and you work in this position, you're going to take that load off the CMC joint.
That's huge. I've had pain in there for better part of a year.
Yeah.
Not currently, but in the past, and it's probably been better part of a year, probably 2 or 3 different times.
Oh yeah.
So like, I'd imagine it's overloading or overdoing one certain thing. Yeah. And then it sits there, and then I'm not doing the right things to address it. So like, maybe I'm rubbing the shit out of this. Yeah. But if it's coming from somewhere else that I need to do.
So you think about it, there's 18 muscles in this hand. That's crazy. So I'll send you the I'll write it down. I'll write it down. And I'll send you the PowerPoint presentation, and I'll let you look through it that Virginia did on caring for the painful thumb. And there's a lot more stuff coming out. She's just excellent, super nice. And you'd be amazed. You see the force couples and the mechanics that go into this. So when you guys, when we look at you guys doing those things like the blob, the inch dumbbell and stuff like that, I'm thinking to myself, look at the muscles that are working right there. So and then that's the thing too that I love about it is that if you do, so they found that the carpal ligaments yield or fail at 58 pounds of force. So at 58 pounds of force, just the carpal bones, the ligaments would rupture if you exert 58 pounds of force. So, and then you say to yourself, okay, well, I just did 100-pound grip strength, and if that's 10 times that at the wrist, that's 1,000 pounds. You said it yields at 58 pounds. It does, so that's why the dynamic stabilizers, the muscles outside your forearm and wrist, have to jump in and take over for that. So when you're doing, if guys are just doing grip all the time, and they're not doing things like shoulder stabilizers, trunk, core, all that stuff is going to keep going to place because it's all connected. Yeah. There's fascial connection, so you've got to have good balance between extensors and flexors. Right. Even for those guys that do all the forearms, they get these big forearms, but they don't have good extensors at the same time. They're just going to have, you get some of these people that can't straighten their finger up and they go like this because these extensors are so weak. Right. You got to be able to get them all out there, and so it's just there's some really neat stuff that
that's crazy.
Yeah, it's really cool.
That's awesome, dude.